Happy Chinese New Year, year of the fire horse. But we are still in water season, so I'm plugging along with our series on the water element for a little while longer. And last week we were talking about kidney pathologies or patterns of disharmony associated with the kidneys. And I'm going to be continuing on with that this week. So today talking about combined patterns of pathology associated with the kidneys. So mainly yin and yang deficiencies. And the kidneys, as I've mentioned before, are the root of our yin and yang qi. So there can be different kind of flavors of yin and yang qi associated with different organs or meridians being depleted of that yin or yang. And then when it reaches more of a systemic level, it becomes kidney yin or yang deficiency. So systemic yin and yang deficiency is synonymous with kidney yin and yang deficiency. But there can also be combinations where you're seeing it presenting as a kidney deficiency and something associated with another organ. So the organs that are most affected by yin deficiency are, of course, the kidneys, the liver, the lung, the stomach, and the heart. And so mainly yin organs themselves, with the exception of the stomach. So those are the ones that are usually susceptible to yin deficiency. And yang deficiency affects generally the kidneys again and the spleen. So the first pattern we'll go through is the kidney and liver yin deficiency. So in addition to the signs and symptoms we might see with just plain kidney yin deficiency that we covered last week, you might also find the pulse is a bit wiry, which is associated with the liver disharmony, usually more so like a stagnation of qi. And for more information on the pulses, you can also go check out my videos on pulse and as well as on tongue diagnosis. Speaking of which, the tongue would be red and peeled or lacking in a coating, so kind of raw looking. There might be signs of inflammation with the liver yin deficiency, because then the deficiency of yin with the liver makes you vulnerable to what's called liver yang rising or liver fire. So that can be signs of like heat, inflammation. This can result in the most severe case in stroke, or in high blood pressure for certainly. In addition to the signs more associated with the kidneys, like just in general, dryness, dry eyes, dry throat, potentially night sweating. If you have a menstrual cycle, a scanty menstrual cycle, so not very much bleeding, or perhaps a lack of a menstrual cycle, not due to menopause or birth control. And so potential causes of this would be blood deficiency, which is kind of like a precursor to yin deficiency. Blood is like a more of a yin substance than, say, our qi, which is more yang. So for whatever reason, having a deficiency of blood, whether it was literally blood loss or there's some lack of nutrients or nutrient absorption. Also, chronic ingestion of hot substances, like alcohol is typically hot. Certain medications can definitely deplete yin. And so, yeah, with the liver, kidney and liver, it's kind of like stressed, high blood pressure, are the typical symptoms. And then the next pattern is called kidney and heart not harmonized, which is essentially kidney and heart yin deficiency. But the kidneys and the heart have a special relationship that we'll get into more later. But signs of heart yin deficiency, signs associated with the physical organ of the heart, like palpitations, particularly with anxiety, as well as insomnia, particularly trouble staying asleep. So you may be able to fall asleep okay, but then there's waking through the night, a kind of light sleep, difficulty kind of getting into a deep sleep is a sign of yin deficiency. Night sweating also can be a sign of heart yin deficiency. And again, pretty much for all of these, the tongue is going to be red or on the redder side, and peeled or partially peeled, so lacking in coating, raw looking, potentially with a crack in the tongue or multiple cracks, with really severe or different kinds of heart yin deficiency, that the crack will go all the way to the tip of the tongue, the tip being associated with the heart. The potential causes of this could be just, it could have started with kidney yin deficiency, and yin is the kind of the substance through which the heart and the kidneys communicate, so something disrupting this communication, as well as severe emotional shock, perhaps trauma, can cause this lack of harmony between the heart and the kidneys. Next, the kidney and lung yin deficiency. So with lung yin deficiency, you might have signs like a dry cough, and feeling of heat in the evening. So as I was saying last time, symptoms that come later in the day or at night, especially having to do with heat, sweating, tend to indicate yin deficiency, because that is the yin time of day or night. And night sweating could also be indicative of this combined pattern. Could also, more severe lung yin deficiency could have even like a bit of blood in when you cough, certainly dry throat and mouth. And so this could start as what's called lung dryness, or lung qi deficiency, maybe both, giving way to this more severe pattern. And again, the tongue would be red and peeled. And stomach and kidney yin deficiency, the last of these combined yin deficient patterns we'll talk about, could be indicated by burning or acrid sensation, perhaps acid reflux. In addition to the other yin deficient signs and symptoms, the tongue could also, in addition to being red and peeled, could have a midline crack as well, so down the middle of the tongue, but not to the tip, more just kind of to the middle of the tongue, related to the stomach. Could also be like a dry yellow coating on the tongue, indicating some heat, which can often go along with yin deficiency. And so this could be caused by multiple factors, including eating late at night or during the night, lots of spicy or energetically warm foods, and like fried foods. And again, alcohol can be very warm, although that does definitely affect the liver particularly. So certain eating habits that put a strain on the stomach. The stomach's weakest point in Chinese medicine is kind of like late evening, or around like roughly like 7 to 9 p.m. when a lot of us are having our biggest meal of the day or close to that. And so it may not result in something super severe, but it can definitely deplete our stomach qi, to make our stomach and our digestive system work that hard as we're kind of winding down and certainly going to sleep. And then lastly, the last combined pattern is this kidney and spleen yang deficiency. So other end of the spectrum from the yin deficiency, which is like people might be a little more like wired and more visibly like stressed or agitated, kind of giving way to signs of heat. Whereas yang deficiency is more like just exhausted, lethargic, slow moving, slow talking, just really depleted and just even hard to talk. They may have enough energy to kind of whine about how bad they feel, but not with much vim and vigor. So key symptoms with that would be related to the digestion. The spleen patterns tend to have a lot to do with the bowel movements, actually. Chronic diarrhea, and a feeling of chilliness. So rather than that like feeling of heat that we can have with yin deficiency, more tendency to feel cold, may feel specifically cold in the low back associated with the kidneys, or just in general. And the pulse is going to be deep, kind of hard to feel, maybe a little bit slower, and whereas with yin deficiency it would be a little more rapid. So from a Chinese medicine perspective, like a healthy, moderate pulse is about 4 beats per breath. Faster than that is rapid, and slower than that is slow. And the tongue maybe will likely be pale, maybe swollen, puffy, and more on the wet side rather than dry. So that's it for the kidney patterns. So we've covered a lot, and then I was just going to say a little bit more about that relationship between the kidneys and the heart, since it is so essential. And So the heart, from a Chinese medicine perspective, is seen as the seat of the mind. The character for the heart not only indicates the physical organ, but also the mind, which is associated with both cognition and emotion. So it's mind, body, and spirit, all represented by this one character associated with the heart. So very significant. You may have noticed there is no brain meridian in Chinese medicine. The brain is actually associated with the kidneys, but the heart is the empress, so to speak, is like the ruler of our body. And then the kidneys are very essential in that they are associated with our jing, or essence, that I was talking about a few classes back. Essentially the root of life for us. You can kind of think of it like genetics, what's passed on from parents to children, and also the kidneys they're what give us our willpower, our drive to survive. It's that seed of potential, and like at the root of us. And then the heart is what allows us to manifest ourselves into the world, into being. And so together the heart and the kidneys are about manifesting our will, manifesting our true nature. And so when this communication is disrupted, it can be really, really debilitating. And so like I was saying, trauma can affect that, shock. This relationship, these two organs together, is referred to as Shao Yin. And in Chinese medicine, there's an old theory based on a book, a treatise called the Shanghan Lun, or the treatise of cold damage is how it's translated. And so it's basically was the basis of this whole school of thought that still holds a lot of weight today, that all disease is rooted in cold. So coldness is the cause of all disease, even if it transforms into like a heat pattern. But we don't need to get too deep into that. But there are outlined in that treatise are 6 stages of disease. And so the second to last one is the Shao Yin, which that kidney and heart pairing. So each stage has a pairing of organs associated with it as it gets kind of deeper and deeper. And those patterns, the Shao Yin pattern is kind of essentially like what we were already talking about regarding the heart and the kidney disharmony and yin deficiency. And then there can also be more of a yang deficiency side of it, which would manifest with aversion to cold, extreme fatigue, desire to sleep, diarrhea and clear urine, maybe copious amounts of clear urine, pale tongue, and it might be a bit swollen or kind of flaccid, wet, and the pulse would be deep, so kind of you have to press down to find it. It may be thin as well, whereas the other pattern of Shao Yin, like I was saying, is more that heart and kidney yin deficiency with insomnia, dry mouth and throat, red tongue, peeled, a rapid pulse that may also be thin, and the urine might be dark, indicating a lack of hydration, and maybe also a sense of mental restlessness. Again, that heart being associated with our mind, so restlessness, mental restlessness is often a heart disharmony.